is Crystal. I'll be your student nurse today. Can I get your name and date of birth? As they're stating this, I'm checking their wristband, probably as well as scanning it. I'm going to perform hand hygiene today. I'm going to be accessing that port because later we're going to be doing a blood draw for some labs for you. And so sometimes these can be difficult to see on a patient depending on their size. This patient is pretty small. I can see the port right in their chest there. And I want to make sure I'm looking at the skin integrity on that. And then also before I entered the room, I checked the orders because you want to make sure you have the right orders. So I have a normal saline flush, so I'll flush this once I've accessed the port. A lot of facilities are getting away from using a heparin flush. If that were on the order, I would also have a heparin flush with me to do after my normal saline. So now that I've assessed the port, I have all of my supplies that I need. I want to get my flush prepared. Make sure all the air is out of here. I'm going to attach it to my PosiFlow. I put it in the wrong way, so it would be in this way, the part that I can attach right away, so that I don't have to touch any part of it and it can remain sterile there. And next I'm going to get my Huber needle ready. And this I have to be careful with because I have to make sure that it stays sterile. So all I want to do, I would open the package without touching any part of the inside. So I'm just going to fold this part back, the part that I touched to open it, just enough so that I can attach my PosiFlow and flush without actually touching inside at all. So we're ready, and this is all still sterile here. And I kind of want to adjust it so that when I have my sterile gloves on, I can get it out easier. Okay, so now I'm ready for my kit. I'm getting my sterile field ready. I'm gonna just wash my hands just because I took my gloves off. Take my kit out. Unfold my first flap. There's a mask in here, so there's only one, so I would be putting this one on, and then I would have brought another one for my patient. But I already have one on, so we'll use this one for the patient. And then I'm going to unfold, being really careful to maintain this sterile field here. So there we go. Then to get my gloves on, well, and now I contaminated my sterile field because the outside of my glove package is on it. So I would start over. For demonstration purposes, I'm just going to keep demonstrating how I would maintain a sterile field. So I'm going to make sure that I have enough room to open this without reaching over my sterile field or my gloves. Okay. So then we'll restart this way. So I'm not touching my sterile field, I'm not over it at all. And now I'm going to reach over. Put those on. Okay. And now I need to clean the port site. So I'm going to grab my chlorhexidine. And I'm going to use a lot of friction. And I'm going to go for 30 seconds horizontally. It's a little difficult on these chests to demonstrate the friction appropriately, but I'll do my best. Now I'm going to go vertically for 30 seconds. And in concentric circles. Of the mask. Okay, and now I want to allow that to dry because it can hurt the patient too sometimes if you go in without it being dry. So as I'm letting it dry, I want to get my huber needle and I want to do it sterilely. So I'm going under here, grabbing this. I'm still sterile on both hands. And I'm letting it dry. We'll say more than 30 seconds have gone by. And so this is going to become my clean hand. I'm going to palpate and kind of find the center of that port here. And I'm going to insert so I can kind of feel the back of the port. Okay. Now hold on to those little butterflies. Make sure I'm unclamped. And then I want to aspirate for a blood return. If I wouldn't get a blood return, I would ask the patient to raise their arms above their head, maybe do a jumping jack, cough, deep breathe, and see if I can get a blood return that way then. And so then I would do the push pause method for the flush. Okay, and I want to clamp it. I'm going to take my flush off right away here. Get my bio patch ready. So we say blue to the sky. You want the bio patch between the needle and the skin. So there we go. And then for this, because I'm going to do a blood draw later, you could either hook up fluids. So if they had fluids that needed to be hooked up right away, you would scrub this off, scrub the end of the fluids, and then connect the fluids. If you were to lock it, you could probably put some tape there to lock it for you. But you have to have an order for all those things. So for now, I'm just going to scrub this off for 15 seconds. Okay, that's clean. And then I want to put my dressing on. So normally I would have a shirt and pants dressing and there would be little slits that I would have to make sure that the tubing goes in. But for demonstration purposes, I have a Tegaderm. So I would just peel this off, place it over the port and the insertion site, making sure that I can clearly see it, because if you can't see it or if the dressing is not transparent, you have to change the dressing more often. So since it's transparent, I'm going to put the date that this was on and my initials so that we know when we need to change it again. So then dressing is on, this is clean. I would clean up after myself, perform hand hygiene, and document my findings. So I'm going to document the date and time that I accessed the port, the patient tolerance, whether I got a blood return, the ease of the flush, and that is the end.